Hello students, now I am going to discuss about various antiarrhythmic drugs. Class 1. Sodium channel blockers. Quinidine. It is a class 1A antiarrhythmic drugs. It is an alkaloid obtained from cinchona bark. The mechanism of action of these drugs is it generally acts over cardiovascular system. It blocks the sodium channel in the open state and decrease automaticity, excitability, rate of phase 0, depolarization and conduction velocity, which also blocks potassium channel, which increase duration of action potential. It also prolongs effective refractory period of as a result of blockade of both sodium and potassium channels. It suppresses ectopic foci and blocks re-entry of impulses. It can be used as arterial and ventricular arrhythmias. Here we can see some adverse effects are diarrhea, thrombocytopenia and fall in BP also. Hepatitis and fever can rarely occur by the use of some sodium channel blockers. Large doses of quinidine may produce a syndrome called synchronism. Now, class 2 drugs. These are the beta blockers. From the beta blockers, now we are going to discuss about propranolol. Propranolol depresses the phase 4 depolarization state, which decrease automaticity in SA node, myocardial contractility and conduction velocity, which also suppress adrenergically mediated ectopic activity, prolong the refractory period and decrease the conduction velocity in AV node, which makes them useful. Some uses are it may be used as treatment and prevention of supraventricular arrhythmias, especially associated with exercise, emotion, or hyperthyroidism. The adverse effect with this type of drugs are drowsiness, hypotension, blurred vision, confusion, and convulsion. The next class is class 3, amiodarone, which is a iodine containing long acting drug and duration of action is weeks to month. It is structurally related to thyroid hormone. Amiodarone, this is the mechanism of action of amiodarone. Amiodarone block potassium channel, which increase duration of action potential and also prolong refractory period and suppress abnormal automaticity. It blocks sodium channel in the inactive state, which decrease conduction mainly in the peripherally depolarized tissue. It also blocks sodium and potassium channels, prolong refractory period in the cardiac tissue. It also has weak beta-adrenergic blocking and calcium channel blocking action. It decreases heart rate and AV conduction. It may be used as supraventricular and ventricular tachycardia. The adverse effect of amiodarone is it mainly affects on cardiovascular system. It can block heart, prolongation In QT, bradycardia, cardiac failure, and hypotension. Here we can see QT prolongation, a terminology which means it is a disorder of heart's electrical system that predisposes individual of irregular heartbeats, fainting spells, and sudden death. After that, we can see it also affects on pulmonary section. It may lead pulmonary fibrosis, and it also may affect on GIT disturbances, hepatotoxicity. It also blocks peripheral conversion, cause hypothyroidism or hyperthyroidism. Next class is class 4, calcium channel blockers. By the calcium channel blockers, verapamil is a drug. It blocks both activated and inactivated L-type calcium channels. Depress calcium-mediated repolarization. Verapamil decrease conduction velocity and increase refractory period of AV node. It is useful for terminating ventrally involving AV node. It also reduces ventricular rate in arterial flutter and fibrillation. The adverse effect of this drug is constipation, sinus bradycardia, AV blockade, headache rarely.